Of all, I want to thank you all for taking the evening in order to come out here and join us. I know with the holidays about us, you could be doing a whole bunch of other things, and somehow you found this to be a little bit more exciting. So we're going to try and make the best of it. And as many of you may know, what we're going to be doing here is doing something a little bit different. Though you're going to be seeing the PowerPoint slides, I've really kind of worked with everybody to set this up more as a panel discussion. And as we go through this event, not only are you going to learn a lot along the way, but we are going to unmute everybody towards the end. In the meantime, what I'm going to ask everyone to do is if you have any particular questions, put them in the chat. We will, after we finish up the panel discussion, we're going to use those additional questions in order to have a little bit more fun and really dig deep into this one. So please bring your A game because there is no other time that I could bring this amount of experts together in one location in order to answer every question you might have about Velora. So without further ado, I am going to introduce you to Lance Liberty. I'm going to introduce you to Gigi Goddard. We're going to introduce you to Dr. McGrath, Stephanie Smith, and of course myself, Mark Durante. To make this a little bit easier, because I could never give the dues that these people are owed due to their accomplishments. So I'm going to let each one of them kind of step around, say a little bit about themselves so that you have the perspective of who they are, where they're coming from. But let me just say this. I feel absolutely blessed to have all of them here because they have played an integral part in our capabilities of bringing Velora to the market. And so without further ado, I'm going to start with Lance first and then kind of work to Dr. McGrath, work to Gigi, work to Stephanie, and then I'll make a quick little introduction and then we're gonna get started. So Lance, I'm going to let you take it away, buddy.
Thank you, Mark, for that very gracious introduction. It's been a real pleasure working with you and your team for the past few years, helping to co-develop some of the technologies that we're going to cover this evening. And we really got into this at the right time. The fatigue of fillers is beginning to set in. There's actually hashtags you can look up like filler fatigue. And it really hit high speed probably about 2.5 years ago when Kylie Jenner dissolved her facial fillers. And it started this whole trend of reversing fillers. Stephanie's also got an excellent video that she can share from a provider that looked about expanding of dermal fillers, migration. Dr. McGrath can go over with you some of the long-term side effects we're starting to see, where there can be blocking of lymphatic drainage ducts, potential considerations for increasing lymphatic cancers from all of the chemically cross-linked commercial fillers that are out there, your Allergan products, your Galderma products, so on and so forth. Then you've got your Sculptras, like your PLL. And while that's a biostimulator, similar to what you're going to be looking at tonight with growth factors and platelets, it's a biostimulator in a much more aggressive way. So PLL, polylytic acid, is the same ingredient that they make sutures out of, for example. So you're putting that into the skin, it's creating an inflammatory response, an immune response. That's how it's stimulating the collagen synthesis. So even though it's stimulating collagen, it's doing it in an injury response way. Whereas we're going to be developing much more vascular tissue that's going to be more long lasting. It's going to act more naturally. If you've ever seen anybody that was overfilled, you've probably noticed how the skin becomes more porcelain like in appearance. It's got that unnatural shininess to it, like the scary dolls, like Annabelle from the horror movies, because it's hydro dissecting the vasculature from dermis and the epidermis. So there's both visual and physiological long-term side effects to these commercial facial fillers that are all chemically cross-linked with polymers. So tonight we're going to be going over the technology of biological filler. We're stimulating the body to create more collagen, elastin, fibronectin by itself. The only downside of what we're going to discuss tonight is you have to explain to people it's a little bit more of a process. It's not this immediate quick fix that's going to gradually go away and have to be repeated. It is a building blocks process where we're going to always be increasing over baseline, and we're going to be doing so in a physiologically appropriate, safe, and effective way. Your side effect profile goes way down when you look at this type of a protocol. It's almost completely eliminated, really, outside of injection site swelling. And there are some techniques that we can go over with you at our advanced clinical trainings that we do at the University of South Florida School of Medicine, and that Mark and his team and our travel training teams do all throughout the country, with needle usage, with cannula usage, just some tips and tricks that'll help to reduce bruising when you're doing like tear trials, under eyes, some of those more difficult areas, regardless of what you're injecting. There are some technique enhancements that can make it easier. So when you work with the Velora team and Mark and the rest of us, it's going to be about 80% science and technology, 10% communication marketing, and 10% just clinical pearls to show you how to maybe deliver this biofiller slightly different than the way you're used to with commercial filler, and you'll find it to be a lot more forgiving. I know Stephanie and Dr. Bob and I, we really love working with people that don't have a lot of filler experience with our product because it is so forgiving. If you use a
Mhm.
chemically cross-linked filler, you got to reverse it with hyaluronidase. It's a big mess. If you do filler over a period of time, you're going to get a facelift or something done. You have to have it surgically excised before you can do a lot of those things. You don't have those problems with biofiller. So, I'm not always a huge fan of the Kardashians, but got to give props to Kylie for bringing some popular attention to the dangers of commercial filler and reversing it. And then also like Madonna for going to that awards show looking like the bad guy from the Saw movie. That helped a lot. Started that meme.
Yes.
If
Yes.
you saw a
Well,
time traveler in the 80s and you told them that Roseanne was going to look prettier than Madonna, no one would believe you, right? It started.
yeah.
Stephanie and I actually use these in our presentations to clinicians and to patients. If you have a sense of humor, I would highly encourage you to bring that into your consultation room with you because you can laugh, but it's also serious. That's also a real example of what can go wrong and why a patient would want to consider using the Velora protocol. So I hope I did not
Well,
steal too much
no, no,
thunder
no,
from
you didn't. I
anybody
mean, you
else.
covered slides 1 through 28. So, I mean, to everybody, a good night.
He did. He did.
But I just meant to say that the timing is right. You're here at the right time. People are
Yes.
asking, patients are asking for this now. When we started doing this, when we began using PRP and PRF in orthopedics, then in aesthetics, we started doing biofiller probably about a decade ago. No
That's
one
right.
knew what the heck it was. Our technology was really rudimentary at that point in time. We hadn't developed the patents that we hold on it and so on and so forth now. We hadn't developed the clinical protocols or the longitudinal data that we have now. And you were trying to explain something to people and they looked at you like you were an alien. But now, every day, patients come in and say, do you have natural fillers? Do you have alternatives to these? The patients themselves are now demanding it. So while we never thought that we would be in that type of a situation where people were asking us and we were going to have to explain it, that's where we are now. So if you're not offering biofiller yet, you're going to be forced to at some point in the future because this is definitely becoming a mainstream popular protocol.
Well, and I think too, at the same time, it is a couple things that we definitely want to set the stage for is that there's biofiller and then there's going to be Velora. But on top of it, Lance brings up a lot of great points about the challenge that the market's having with the traditional filler, but just know at the same time, this is really kind of that answer for giving the more natural approach to giving them volume and regeneration. But we'll also talk about this tonight. And for those of you that are not ready to move away from your filler completely, how you can integrate that in with existing filler or how you can integrate that in with biostimulators. And that's a thing too, why, I really enjoy these guys coming on here because they've been in the field for a long period of time and they've seen a lot of different looks and what's happening. I mean, I myself have been in this field for about 28 years, and I've watched this develop over the course of time. And we are in a new revolution when it comes to the filler space, and we've seen that kind of play out over the past couple of years as we've watched the filler market start to decline by about 20%. That's a kind of a statement that the market's making in general. Whether you've seen it in your practice or not yet, it's just showing that the moment is coming and that people are starting to move towards a more natural type of appearance. But before we go any further, because I don't want to ruin all the beautiful questions I have for the panel as a whole, Lance, why don't you tell them a little bit about yourself? Because I think that your back end story is pretty impressive. And then Dr. McGrath, we want you to jump in there as well, and Gigi and Stephanie.
Well, it ties in together. So I actually, Dr. Bob's son's chiropractor, he was my first customer when I opened my advertising agency back, oh gosh, 22 years ago or so. And we were promoting his non-surgical spinal decompression practice. A couple years after beginning to work with him, I had a high school football injury that was surgically repaired and it failed. And I developed early onset post-traumatic osteoarthritis. And Dr. Bob McGrath Jr. introduced me to Dr. Bob McGrath Sr., who was injecting hyaluronic acid, like you all use in faces, in joints and using it for stopping the progression of and even potentially reversing osteoarthritis of the knee and other medium and large joints. So his son invited me to fly up and stay with him, convinced his dad to drive in from the city and inject my knee with hyaluronic acid. I had some pain relief from the first injection. Pain was gone by the third. Full function was restored by the fifth. And then I decided to try and twist Dr. Bob's arm and get him to quit the pain management group that he was a partner of up there in northern New Jersey and Manhattan, and come start a medically integrated regenerative medicine practice with his son, the chiropractor, and his 21-year-old at the time marketing consultant. So that was how this journey all began. We wound up building probably the single busiest non-surgical knee clinic in the entire United States. I mean, we were doing some days 60, 70 patients, 6 days a week, nothing but knees, knees, knees. People coming in walkers and wheelchairs, going out under their own power. It was a beautiful thing. But since we attracted so many elderly patients, we also attracted a lot of the comorbidities that come along with it. One of them was urinary incontinence. And they'd leave their adult diapers in the restroom and around the place. And Dr. Bob got frustrated with it and said, well, if I can't kick them out or close the restroom, I'm going to find a way to treat it. So he wound up looking up Dr. Charles Runnels from Fairhope, Alabama, the inventor of the vampire facelift, vampire facial, O-shot, and P-shot. And we traveled down to Fairhope, Alabama to learn how to do O-shots and P-shots. When we came back to the clinic and just put a little 8.5 by 11 up on the reception counter, crazy phenomenon happened. Patients started canceling their joint injections so that they could do vaginal and penile injections. I don't care if I can walk. I care if I can fornicate. People wanted to buy what they wanted as opposed to what they needed. And from that day forward, the percentage of our clinical practices and even our overall business model has gone less and less insurance, orthopedic, more and more aesthetic, anti-aging, functional medicine, now even getting into lifespan medicine and longevity medicine. So the demands of the patient population really pointed us in that direction. And the beginning of our research into novel biological aesthetics products came when we were taught by Dr. Runnels how to do the vampire facelift, because Mark, you had mentioned using your commercial fillers, your traditional tools with your regenerative tools. That's what the vampire facelift is. It was balancing
Correct.
with Juvederm and then using PRP as a biostimulator. So that's what started us into this. And the hyaluronic acid PRP device that we're going to share tonight was this concept that we had traveling back from that event. Man, those procedures were great. The patients looked great, but it took about an hour. And we were injecting the same sites twice. What if we did it at the same time? And that's how Dr. Bob and I started collaborating on inventing our first piece of medical equipment together. So that's a good tie-in for you, Dr. Bob. Hope I didn't steal too much of the story, but that's how we got to where we are today.
No, you really didn't, Lance. I mean, it was evolution, and it was enjoyable the entire way. We just went from one area into the next area, and my idea was getting into like the orthopedic applications initially, and from there, because of the cost and everything, Lance got really involved in getting something with the PRP to be a little bit lower cost so the people could afford it. Then we got into the aesthetic market. We had to do something to help with that market. And it's been just an evolution, one thing after the next. And each one, honestly, we have been so lucky. It's been so successful. And Velora is the evolution of a lot of work, a lot of trial and error, but we have been wildly successful. And it's been so enjoyable to bring something like Velora into the marketplace and to help so many people. People want things that are natural now. Look what Kennedy's doing. He's just asking people to, look at the science behind some of this stuff. The people out there that are old enough to look at people like Wayne Newton, look what he's done to his face. The guy looked like he had a pumpkin for a head, and that's all because he used filler that was clogging up his lymphatics, whereas Velora does not cause that. Okay, and that's the evolution of where we've gone from Lance, and now we're getting into some other areas, especially tonight. You're going to really see the evolution with the platelet-rich fibrin that is just amazing to use. Not only just for fillers, but there's other applications certainly that we can show tonight, and it's just been enjoyable to give people solutions that are natural, that don't cause any side effects, especially if someone coming into your office who's pregnant. What can you say out there that's safe to use in pregnancy? Velora is safe to use in pregnancy.
That's how the vampire facial became popular. Kim Kardashian had that done when she was pregnant with Northwest.
Yeah.
And one other thing I want to point out real quick, and then we can hit it off to Gigi, is what Dr. McGrath was talking about with Wayne Newton and what I mentioned with Madonna. It's commonly referred to as moon face. But the truth of the matter is that is lymphedema. That is facial lymphedema. So we need to make a point to actually use the proper clinical terminology when we're talking to patients to let them know that some of these procedures they're doing for aesthetic beautification can actually be causing chronic disease.
Well, and you know what, too, and Gigi, before you kind of get started in this, because I think I can actually start this, and I think you're the right person to kind of get us really kind of a good description of what Velora is. But let's kind of start real simple for somebody that might be new and joining us today and trying to learn about Velora for the first time. And what I really want to bring to the panel itself is what exactly is Velora and how would you describe it to a clinician that's hearing about it for the first time? And Gigi, I'm going to start with you after you would kind of share a little bit about yourself.
Sure. I'm a dinosaur in the industry and proud to admit that. Been doing it for 24 years, teaching it for 22. So the great thing about that is I have seen all the good, the bad, the ugly, and have watched this evolution. As Lance said, it started with the Kardashians and it's almost ending with the Kardashians. And so it has come full circle. You know, I think, as Mark and I have these discussions all the time, it's kind of like my Swiss Army knife in a practice. And it's our job as the practitioners to educate the patient. And to Lance's point, I do bring stuff in, to my patient's room to say, hey, listen, you started getting filler, in 5 years ago. Okay, so look at some of these patients, i.e. Wayne Newton and, everybody else out there in Hollywood, that because it's cutting off that vascular, compression, they look like a putty face. They look like they were, completely, formed out of putty. So to me, it's a simple to get them to turn over because filler has been such a big thing. And what everyone asks me when I train, how do you get them? Because we're over inundated with Jupiter commercials and wrestling commercials and all these things. How do we, and Dr. TikTok, oh God, that they're watching all of these things. They're in their bathroom trying to do it themselves. It's become, out of control. But I tell them, I take good care of my skin. I do a lot of biologics. And what I tell them is, I'm 60 years old. I haven't put filler in my face since 2015. So when they ask, well, why do you have filler? What do you do? Because obviously this is what I do for a living. I sit down and I have the deep conversation with saying, hey, listen, this is something. Would you rather have something that you cannot be affected by? No granulomas, no allergy, no adverse effects. No. Who's going to say no to, hey, let me tell you how this works? And everyone is familiar because of the vampire facial with what that does or what they saw in the Kardashians, but they don't know the science behind it. And to actually put this in place of, okay, we have PRP, it's doing this, this, and that, but giving them the science behind Velora to say, you know what, this is something that you can do for life. And you're never going to look like, a train wreck or a putty face or what have you. But the other benefits to it, because you have this, if you're that practice that's Botox filler, this just gave you the Swiss Army knife of things that you can have: sexual wellness, hair restoration, facial rejuvenation, neck, bottom. You can put it everywhere. It's kind of like Windex, like the movie.
My Big Fat Greek
Yeah,
Wedding.
My Big Fat Greek Wedding. There isn't a place where it can't go.
Yeah,
So,
you heard it here, right, Gigi?
Yeah,
you heard it here. This
exactly.
is your new Windex, everyone.
Yeah, that's why I tell everyone. It's like the Swiss Army knife. There isn't really anything that is, that you can't do with this that's, not going to be beneficial to you or your practice.
Well, and I think too, as we're kind of looking at this, and Stephanie, I want to get your opinion on some of this as well, is, when we first set out to kind of create Velora, a lot of it was answer the call for what's happening in the marketplace. I think the key thing too is that a lot of times people would go to a course over a weekend, come back and suddenly feel that they were a master injector until they ran into an issue or got an outcome that they didn't like. And so in doing so, traditional filler is not forgiving. However, Velora is. So if you get to a point where you make a mistake or you're going walking through the learning process, this is probably one of the best type of fillers that you could do, because here you're giving something that not only creates the volume like you were looking for, but is actually causing restoration in that facial tissue at the same time. And so, Stephanie, I mean, you're kind of a little master at this at the same time. Maybe you can give us a little insight, in where the development of this all took place.
I'm just the Uber Eats driver, delivery man. Just waiting
Yeah,
for
that's
my
right.
to drop the food off. No. So my name is Stephanie. I'm actually the business money person. So when we talk about in this industry, kind of where this came from, we've talked a lot about filler fatigue and things like that, but I think it's more than that. I think we are, as a society, craving a more natural approach for everything that we're doing. This transcends our healthcare entirely. So I think when we're learning to do something for the first time, especially facial fillers, I have doctors that have been doing fillers for 20 years that still suck at it. I have doctors that have been orthopedics for 15 years. You hand them a syringe and they are great at fillers. It's artistry. There is no rhyme or reason to who's talented when it comes to doing fillers. So when we talk about learning a new product and having I always tell people when you first get into fillers, the first 25 people you inject should love you no matter what, because there is a learning curve with everything. The biggest benefit to Velora is that learning curve is somewhat significantly less, to be honest, because it is more moldable. It is more forgiving. You can smooth spots out with your finger and have a little more give in that product play than you would with a cross-linked HA whose Dalton weight is 2.5 million Daltons. At that point, we don't have a lot of play. And what that does essentially is that affects the bottom dollar. When we talk about the cost per procedure, I mean, I know a cross-linked HA filler is ballpark $300 to $500 per CC clinic cost. When we can make that in clinic for 90% less, why aren't we? Just from a business perspective, you know what I mean? Not to mention,
Correct.
The biggest thing I've been talking to people about in the last few months is don't throw your fillers away. Start crosswalking patients back across that line to natural aesthetics. Partner these products together until we stimulate the growth factors and the structural integrity of the face and collagen production, and then start to phase them out a little bit more and a little bit more. I'm over here with Gigi. I'm almost 50. I've never done a cross-linked HA filler. I've never done Botox, but I can guarantee you I've had plenty of run-ins with Velora.
Yeah. Sometimes we just fall on the needle, right? It's just fall on the needle.
Oops.
Listen, I will never be someone that says don't get high on your own supply. However, I do think moderation is crucial and key. And when we talk about the aesthetics industry as a whole, we haven't used that standard with filler. I think we're gearing more towards that. And if you look at the trends in general aesthetics, it is a more natural look. Makeup, hairstyles, all of these things are now reverting back to a more natural approach. And I think filler's the obvious thing with that. So, I'm not going to be the person that says throw every filler in your clinic out, but I am going to teach you how to crosswalk it back to a more natural place to be.
Well, and I like that because I think that's what we were trying to talk about from the very beginning is, we're not trying to push you out of the filler space, because you may find some opportunities just kind of give an example, until somebody truly understands what Velora is, they're still going to go to what's comfortable, right? So at that point, they may want to have some of that cross-linking there because that's what they understand. But what if, I think we're going to get in that discussion tonight, maybe you're using the cross-linking to do a particular area and then saying, by the way, because of the amount of volume that we can produce from your own body, not only to create volume, but to create restoration, is why don't I try this here? And all of a sudden, for a very nominal expense more, you're doing cheeks, you're accenting jowl lines, you're doing temples, you're suddenly getting into necks or hands. And there's a lot of off-face applications that I think this is bringing about, because it has so much volume. And we talk about this, and it's one of the next steps that I want to walk into, because Lance, I would love for you to discuss a little bit of this in terms of just what is the protocol or the process that we're following through. Because when you start to look at this, 10 to 13 cc's of volume for every patient opportunity, there's a lot you can do with that. So Lance, if we're kind of starting this off, because you all created something that was really special, and it was in the PRP side where you were just kind of taking a look at this and going, you know what? PRP is great, and that's going to play the key role in regeneration, but we also recognize the value of hyaluronic acid and what it's doing in the skin and what it's naturally or structurally doing in the skin from a non-cross-linked level. So if you kind of want to take it from there, let's give us a little bit of a spin on just give us a highlight of the process first, because we're going to talk about each one of these sections individually.
Mark, could we skip to the slide that has the 60-year-old patient with the before and after with the Velora?
I can.
So, because I want to talk first about the process and how it works, and then also where it's going. Because a couple of people have mentioned here that it can be used anywhere, and it is starting to be used almost everywhere. That being said, it shines and has been well proven in the areas that you commonly do traditional commercial fillers in your nasolabial folds, your pre-jaw area, your glabellas, your 11s, to do a cheek lift. It can be used safely in the tear troughs and the under eyes because it is not containing any of those chemicals and polymers that can be more detrimental. There's another
You said eyes.
example.
You said eyes.
It works very well there. I do recommend that one using a cannula if at all possible. It's the difficult procedure to do with a needle. It can be done, but it's a little more forgiving with a blunt tip cannula there. So these are the things you can most commonly use it with. Some of the things that we begin to expand into from there, doing a feathering technique for the temple. Stephanie had mentioned that this is a product that you can mold post-injection. So for the temple, we will typically use a 30 to 27 gauge 1 to 1.5 inch needle and actually do a little triple feathering technique there, and then run the gloved hand over it to blend, mold, and lift. You can also lift and pull lines out with this. So if, let's say you inject too much, you overfill an area, right? You can now actually pull away from that area with a gloved hand, with a hot compress if necessary, with a mechanical assistive device if you have one in the practice. Like when we're doing some of the body work, if we overfill on any of those, we'll use a shockwave therapy device to actually help us do the mechanical massage with it to move that filler, because we're getting into some crazy stuff with this. So we've done breast lifts with it for years, very effectively, using the protocols trained by Dr. Runnels. One of our training PAs started using it for penile enhancement. This is not something that was on our radar, nor is it something I'd really truly recommend commercializing and marketing to a bunch of people, because one of the things you learn with regenerative aesthetics, it's about restoring normal function, right? So it'll get you back to baseline, maybe even a little bit above baseline. But if you're trying to get somebody miles beyond baseline, a natural product's not going to do that, because it's going to get you back to the best version of you. When you're doing regenerative medicine, everything we do is about restoring us to the genetically perfect version of us that we were when we were first developed, when we were first birthed, getting back to all that collagen that we had, getting back to those more free stem cells we had, getting back to the greater vasculature that we had, to the greater elasticity that we had. If you remember when you were a kid, you didn't tear ligaments, they were rubbery. When you had an injury, you didn't form a scar, it healed more quickly. Part of regenerative medicine is simulating a trauma and then healing it faster so you don't develop scar tissue. So we always tell people it's about getting back to baseline, and that's when we do some of the sexual dysfunction. It's really about restoring function, not enhancing. But if we're allowed to share dick pics tonight, we've got some pretty amazing before and afters for penile filler. We're working with a surgeon.
We
South
did not bring
America.
those forward in this presentation, but trust me, it's an area that a lot of people are, not a lot of people, but that people are going towards.
We're working with a surgeon down in Brazil who's doing butt lifts with this. There's been a lot of news recently of patients being injured and even dying from side effects associated with Brazilian butt lifts. There's a lady out in California presently on trial for her second manslaughter charge for doing Brazilian butt lifts improperly. out there in that state. And when she was released from the first one, the judge said, if you do this again, it's premeditated murder. And, I'm not trying to be scary or over the top of the theatrics, but this is happening. So, like, that's the far dark side of using some of these synthetic products on patients. If they're used improperly, they can create vascular occlusions and they can potentially even kill people. With PRF, because it is a bloodborne technology, while we still treat it like a commercial filler and we draw back and make sure we're not in a vascular body, God forbid you do get in a vascular body, you're not going to kill someone with this product. It's going to be broken down very quickly in the bloodstream. So those are some safety profile things that have actually allowed this to be explored in some of these unusual applications. Mark, we're also using this a lot right now in people that have lost structural fat from GLP-1s. They've lost structural fat.
Yes.
And
Okay.
because of the volume we get from this, we're doing injections into the abdomen now, and
Yep.
it helps smooth where people get, I don't even know how to describe this type of structural fat loss that people that are on the too high of a dose of GLP-1s and things that
Correct.
they're suffering from. They get a waviness to their tissue, and we're able to even that out by using the Velora protocol and these special.
Well, and Lance, I mean,
PRF
don't you
products.
think that's kind of like an important role here? Because I mean, I'm glad you brought up the GLP-1s because we talk about people starting to do this even in a prevention level. You know that you're going to be on the GLP, and Gigi, I can see you're shaking your head. You already have a response to that one.
Oh, yes.
Yeah, because I mean, honestly, while the skin is actually, while the fat is starting to reduce, why not be putting the skin in more of a regenerative type fashion so that it molds more closely with them? Because that's the biggest thing we saw when semaglutide and that sort of stuff came out, Ozempic, is that these doses were high enough that they were draped in skin rather than kind of having that natural retraction. So
and it's not just Ozempic face, it's Ozempic butt, it's Ozempic hands, it's Ozempic
Absolutely.
flanks.
The whole thing.
yeah.
Yeah. And I think what we've been doing when we have GLP patients and some that come in, of course, in a perfect world, all the practitioners out there that jumped on that train, it would have been gradual, not just all of a sudden they lost 50 pounds in a couple of months and then they have this issue. Patients that come in because we do weight loss, we let them know, listen, we're going to take this journey a little bit slowly, and because the face, the neck, that we start that process as we're starting the weight loss process, so that it's not this one day they wake up and they're in shock. Oh my gosh, I look like a skeleton. We're trying to mitigate that and take them along that journey with, so it's not just, oh boy, here we are.
No, and I think, and this is great. And you know what, part of the thing too, and I think really we've been talking about Velora from the perspective of, hey, it's a biological filler, or we're also trying to call it the non-filler filler, right? It is, but there is a step process that goes with this. And that's why I want to kind of go a little bit into this because, as you all played a key role in terms of the invention of the technology that could allow us to bring the protocol forward, I'd like to really talk about some of these individual pieces that are present so that people kind of get an understanding what this process looks like. Because at the end of the day, they're used to seeing volume, and even with biostimulators, now they're seeing a fact where they're not seeing volume instantly, but over the course of time, that impatient patient is eventually going to get what they're looking for. But we now have a solution where we can do these in conjunction with biostimulators and reduce the amount of treatments that they have to actually do while producing a better result and giving them the instant volume that they're looking for. But that all starts with process number one, which is the PRP HA kit. And that's something that's very special to us as a team. So, if you want to talk about that a little bit, just kind of talk about that discussion, why that was developed and the role that it's playing here.
Well, Dr. McGrath and I can volley this one back and forth, but as much as we talk about these hyaluronic acid-based fillers being bad, the positive of hyaluronic acid is that it's hydrophilic. It's very good at attracting and keeping moisture and hydration in an area, and that is one of the things that helps to create an environment for very good collagen, elastin, and fibronectin production, and for revascularization and microcapillary formation. Because when we're doing the Velora protocol, we are creating new permanent tissue. So this is 100% a restorative and regenerative aesthetics approach. And that's part of what you have to build into your patient education cycle, is that you're not going to see me every 6 months forever. You might see me every 90 days for the next 2 years, and then look 10 to 15 years younger for the next 3, 4, 5 years before you need a touch up. And we just bring our patients in every 6 months to touch base, take updated pictures, use our facial scanner, make sure that the underlying physiology is still good. As the structure is good, we also want to make sure the vasculature is good. The sebum levels are where they're supposed to be. There's no UV or genetic damage, because then we can tap into some maintenance products, use things like PDRN to help with any genetic damage before we go in for another round of Velora. So it really does become a lifestyle treatment. And we wanted to capture those positive benefits of hyaluronic acid because it is naturally occurring in the skin. And if you go to the store, to Sephora or wherever, try and find a product that doesn't have hyaluronic acid in it. I mean, hyaluronic acid is used across almost every cosmetic and beauty product because of that hydrophilic nature, because of the ability to hydrate tissue. And that hydrophilic nature does provide plumping. So that's one of the reasons that this was originally explored as a dermal filler. So we wanted to get that benefit, but we wanted to get that benefit without the chemokine profile, without the polymers. You know, people are spending $50 to buy a Stanley cup so they don't drink out of a plastic bottle, but then they're going to inject micronized plastic bottle into their face, which is, I'm not exaggerating, like Bellafill is micronized polymers.
That's right. That's right.
Dr. Bob, did I miss anything there about why hyaluronic acid's important?
No, really, Lance, that's it. And you couple that with the PRP initially going into the PRF, you're trapping those growth factors, the cytokines, the bioactive proteins with the hyaluronic acid in a certain area. So over a period of time, weeks to months, when it comes down to it, you're getting the regenerative process in that area. And that's what this whole thing is about. It's about taking the body's regenerative capacity with the hyaluronic acid to plump in that area, to get the extra moisture into that area, and to, over a period of time, stimulate the collagen and elastin fibers to make you have that long-term look that you want. Go back to infancy.
Hey, Mark, just to put one thing in perspective, if you go back to that picture of the kit,
Yes.
that each tube has 2 cc's of non-cross-linked hyaluronic acid.
That's right.
If you were to buy 2 cc's of HA, just to put sorry, I'm a numbers person.
Yeah, no, go for it. Go for it.
Oh, I'm right there.
Just to put a price tag on that, if you were going to purchase just that HA at the cheapest price point possible, you'd be looking at between $900 and $1,200. So the value of that in and of itself, not even including the PRP, is pretty phenomenal. So all of the kits come with 2 tubes. So if you're already in 2 tubes is what? About
$299. Yeah.
About 4 to 5 cc's of actual filler per tube.
Oh, man,
So
we're getting as
away,
much, depending upon if they're hydrated or not, we can get up to as much as 7 cc's. I mean, it's
I was going to be modest and not say.
Well, Stephanie gets to one of these points now where you're sitting down there and going, I don't even know where to put this. You know, just show me a body part.
Right.
And that's
You
that's
put
exactly
it to
the
go
point.
home. That's what
That's
you
right.
do with leftover, Mark.
kidding.
We'll get to that.
Exactly right.
I did the purple
Lance, that's a great little plug there,
Right.
Lance.
And to Stephanie's point, Mark, when you're looking at this education point of how we're getting it in there and how we're educating our patient, it's kind of a no-brainer that you're not really shifting the price point. I mean, cost to us, yes, but if I'm explaining to somebody the difference between, what the BDD process and the difference between a cross-linked and a non-cross-linked, and letting them know that, hey, too much of this over X amount of years, that's going to compress vasculature and you're going to look like Wayne Newton. Here we have this person. What feeds the tissue? Of course, your vascular system. So if I'm regenerating and creating new tissue and new food for your tissue, if you will. I break it down to simple things like that. So I say, why would you not want that? Something that's good for you. You can't be allergic to. You're not allergic to yourself. You're going to have complete regeneration. It's a journey you're going on to take them and say, as to Lance's point, this isn't happening overnight. But, and looking at Stephanie's face and looking at mine, and I haven't had plastic surgery, not to say I never would, I'm thinking about getting the eyes done. I'm okay, but at the end of the day, if they say, how do you do this? And we say, this wasn't an instant gratification. Or if they say, how long does this take, or how long it's going to last? My simple response to this, how long does it last when you stop going to the gym?
That's a good point.
That is a good point.
Mm-hmm.
And one of the things too that I wanted to bring up, it's we have everybody muted right now, but if you could do me a favor, and if there's certain questions that you want to drop into the chat, so that if you have questions as we go along, we could stop and address some of those questions, because we do want to make this as interactive as possible, and we don't just want the interaction to be between us up here, on the panel discussion. So yeah, I didn't mean to cut you off, Gigi. I just wanted to, we start getting on a roll, and then all of a sudden I'm kind of like, okay, well, it is.
Well, we're scripted talking.
We could do this all night.
Yeah,
they could. We're a bunch of little nerds up here, just
Dr.
having
Bob
a good old
said
time.
A phrase that I think can move this into the next part of the technology, which is the body's capacity for regeneration. And one of the things that we run into a lot at medical conferences and even with patients that have been miseducated is that at a certain age, regenerative medicine no longer works. We get that a lot. We've had people that have said, well, I was told I can't have PRP because I'm too old for it. And I think that Dr. McGrath has done a great job of addressing that both physiologically and then also from a scientific perspective, how we're able to coax the most regenerative potential out of these platelets and out of these patients and these autologous therapies. Would you like to share a little bit about that, Dr. McGrath?
Well, and Dr. Bob, before you say anything, because I think you bring up a great point here. I mean, this is every one of us, if we've talked to any type of patients before, has literally said, no, PRP is not right for you because of your age. So I think like where you're going to go with this part, and I think this is the most underrated part of the technology, because we're always trying to run through the PRP HA and then turning it into a plasma gel that you can inject, and miss probably one of the most golden parts of the entire procedure, which is this part. So,
so
Dr.
in orthopedics and physiatry and surgery, a lot of physicians have hemoanalyzers in their office, and they'll measure the platelets, they'll measure the growth factors. And they buy this product from us because it makes a measurable improvement in the growth factor expression of these platelets and degranulation of the surfactants. So all your growth factors, your IGF-1, your beta endorphin, your VGF-1, your platelet-derived growth factor. People forget about platelet-derived exosomes. These are all things that we want to get the platelets to degranulate. So in ortho, Stephanie and Dr. McGrath and I sell hundreds of these. In aesthetics, people overlook it because they've been trained so much to look at immediately after the procedure what that person looks like, and not the longitudinal so much. But this plays a huge role in the longitudinal outcomes that you get with the Velora protocol. Dr. Bob, would you like to just go a little bit into the biology and the science behind that? Because I agree with Mark, this is a really undervalued portion of what we do. And then for all of you on the call today, I think this is our first large format meeting we've had since the U.S. Patent and Trademark Office officially granted our utility patent on this technology. We've been patent pending for quite a few years. We now have a full-blown utility patent. So those of you that adopt the Voluma protocol and photo activation, you're going to have a patented technology that is unique to you and no one else in your marketplace. So you will have a way to differentiate yourself from the ever-growing number of med spas, and I'll use the term longevity medical clinics.
Well, and Lance, and part of this too, what about the fact that how many people are out there buying growth factor serums? Imagine never having to buy another growth factor serum and be able to use your patient's own living platelets to create your own growth factors in order to create it in abundance to where you'd never have to use any of those products. I mean, like when we look at different products that are out there, a single vial can be $450, and it's a single peptide, or not a single peptide, but a single growth factor. That's synthetically made. Exactly. So at the end of the day,
the funniest part about this is show me anywhere that your body can have PDGF shelf stable.
Yeah,
it doesn't. And the reality of what it is 90% of these products, Dr. Bob and I laugh about this all the time, are plant derived. Since when's do human and plant cells talk?
Right, right.
Anyway, sorry, Dr. Bob,
So yeah,
carry
No,
on.
no,
Dr.
no,
Bob, go ahead. I mean, we've only been taking the,
Sorry.
no,
speech
no,
from
no,
you.
that's okay. This is all really, really important. The thing is that, and I give this analogy or this little talk. I was at a conference and these doctors surrounded me and they said, Doctor, we've been told that after 40 years of age, your platelets don't work. I said, really? I said, give me your arm. I got a box cutter here. Let me cut you. And the guy said, no, 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 no. I said, what's going to happen? You're going to clot, and then you're going to start to get the growth factors, the cytokines, everything to be released underneath. Okay. Ultimately, you're going to get a scab, and then that scab's going to fall off. And guess what? You're going to have regenerated tissue there. So when we get older, yes, our platelets do drop down as far as the numbers, but they still work. Okay. So we're looking at the photoactivator. And what that does is that by polychromatic light, okay, it releases off of the alpha granules, off of the delta granules, off of the lambda granules, that where all these beautiful cytokines, growth factors, bioactive proteins are carried on the proteins. Okay, so now you've taken regular gas and you have turbocharged it. Now you got high test. Okay, by just spinning your PRP down, taking it off, putting a cap on the syringe, plugging it into the ports that we see on the right side of this picture, and pressing a button. Okay, and this has been proven by science for a lot of people out there who don't know or have heard about Dr. Joe Parita. Dr. Joe Parita is one of the godfathers of regenerative medicine. This is all he uses. Okay, he swears by photoactivation and will not do any procedure without photoactivation, whether that's be using aesthetics or musculoskeletal or anything else. He
He
always
uses it
activates.
systemically for autoimmune diseases.
Exactly,
He puts
exactly.
people on dialysis through the photoactivation device for Lyme disease and things of that nature.
Yeah, people say, what about, my friend has rheumatoid arthritis. What can we do? You can photoactivate their platelets. You can get the best that you possibly can get. And people have seen a significant difference in their practice by just adding that photoactivator to the Voluma product.
And when you do, and what you put up on screen with the lab report here, we're talking about 8xing the concentration of growth factors.
In 10
this
minutes.
industry,
In 10
in 10
minutes.
minutes.
In 10 minutes.
Yeah, you
In
can't
this
get
industry-
growth factors delivered that fast through FedEx.
No.
That's right.
Everybody talks about platelet count. And platelet count matters, but let's use another analogy here, right? If you've got an aircraft carrier, what makes it effective? It's the planes that take off from it. It's not the aircraft carrier itself. The platelet is the carrier. It's the fragment of a cell that releases all these growth factors and surfactants. At the end of the day, that's what we're after, is the growth factors. The platelet's the carrier. The growth factors are the biostimulators and biomodulators that are going to get out there and actually cause the paracrine response to take place and the angiogenesis to take place and to cause the fibroblasts to accumulate and to cause the periocytes to undock from the positive pressure capillaries and blood vessels and localize and release exosomes. We talk so much about stem cells in this industry and transplanting them into somebody through allograft tissue, which is great. But you want to get their autologous stem cells working too. So you can actually recruit these pericytes, not parasites, pericytes, Greek for wraps around. They're the adult stem cells that wrap around your blood vessels, and they respond to vascular injuries. So when you concentrate platelets, the body interprets that as there must have been a vascular injury because there's this concentration of platelets. So it's
That's
that
right.
secondary effect. So many people get caught up on what's in the vial, what's in the tube. The truth of the matter is, how does that affect the recipient, right? It's Tinder. We're starting this process, and that's where the beauty comes from. And that's why one of the questions in there was about, how long does it last and how many treatments do you recommend and how frequently? That was from Linnea. So you're going to do biofiller or the Velora protocol about twice as frequently as you would do a commercial HA filler, because of a couple of reasons. The first is, since there are no chemicals and no polymers, it's not chemically cross-linked with latex and vinyl sulfone that they make siding and houses in the north out of, and formaldehyde that they embalm people with. These are ingredients in commercial fillers from the big manufacturers. Because you don't have those in there, the body is not just going to break this down. Everybody says it's going to break it down. It's not breaking it down. It's integrating into the tissue. It's supposed to do that because it's biologic. So then you need to put another layer on there. And you also want to keep the cytokine chain going. You want to have this cytokine trail that keeps those pericytes and those autologous cells localizing. So you want to keep that process going. And the best way is to re-stimulate that. If money's not an issue, every 6 weeks. If somebody's got an unlimited budget and they just want to look 25 years younger, you can do that in 2 years. Come every 6 weeks. If it's an issue, we typically bring people back quarterly for this instead of biannually. That's our normal protocol, 4 times a year. Once they get to where they want to be, twice a year. Once they're looking really great, we still check up twice a year, but maybe we're only doing a procedure every 12 to 24 months. We also have a lot of younger patients doing this. I mean, everybody talks about older patients, but it is absolutely scary how many people in their 20s are being targeted for cosmetic procedures on TikTok, on Instagram. You've got people that haven't even fully developed yet. Your brain's not fully developed. A lot of parts of your body aren't fully developed until you're 25 years old. We got people that haven't fully developed their integumentary system that are getting fillers now, right? So this is a great way to address those people that, unfortunately, in some cases, I think have like almost a societal induced body dysmorphic disorder. At least I can take that patient and do something now to help them physiologically, while maybe I'm also recommending a provider to work with them psychologically. And I don't mean to bring that up, but that is something you do have to keep an eye out.
That's huge, Lance. That's huge, because this becomes an intervention technology at the same time.
Yeah. And Lance, to your point too, is, we as, science-minded people, we understand what Lance is saying. When you get a patient
no, we don't.
in front of you,
That's
on a good day, Mark.
I got to pull this up into ChatGPT now. I'm just kidding.
That after talking to Lance, but when we have a layperson,
he's brilliant.
Yeah, 100%. But we have a better chance of doing. Now, if we throw that all out to a patient, they're looking at you like, what does all that mean? So I do have to break down and, find little fun analogies so that it sticks here, so I can take them on this process. When we're talking about the photoactivation and the boosting, I says, here you go. You have these, platelets, and they're having a party, but now we just took them to, a rave. And, now we're just, so I literally find ways to break this down for them as to why we're doing this journey, how it works, that they can relate to, that they can say, okay, so it isn't as difficult as most people, kind of fear or say, oh, how am I going to get them from Juvederm to this or what have you? Have a conversation. I pull up Cami Parsons, who's a colleague of mine, and I don't know if you've all seen that, the ultrasound of filler. And to Lance's point, it's not going anywhere when it is, a cross-linked filler. It's not. It's there to stay. So at the end of the day, these are all these reasons of why you would not do this process. There's, to me, it's an easy turnover, when they understand and they're educated. And I'm at every 4 to 6 weeks until, like Lance says, we get where we want, and then we're biannually or spreading out quarterly. It depends on the person.
Well, now you've met the genius behind my answers with Lance as well, because, he is the one that helps me through the science, and then Gigi helps me make it simple.
Mark, there's a good question that got trapped in the chat box here that might be a good one to go to the slide where you've got the different densities of the filler.
Oh, yeah. I have that right here.
Stephanie, one of our favorite slides of all time.
I love this slide.
Oh.
Jason asked a great question that plays into this, okay? You spoke about enhancement versus restoration. Many people want HA fillers for enhancement. Is this still a good product for those patients that want enhancements of lips, cheeks, jawline, etc.? And the answer to all those applications is yes, and this slide is why. You can adjust the viscosity and the molecular weight of the Velora biofiller by how long it's in the incubator for, which we haven't even covered yet. So if your lips, that's typically something we're going to run maybe 4 to 5 minutes of incubation, and we're going to get something that's smoother and easier to use. We can use it on the lip flip technique. We can use it for the vermilion border. It works great. If we want to do, your typical areas of volumization, like your nasolabial folds, your prejaw area, cheek enhancement, tear troughs, glabellas, the feathering technique of the temples. That's going to be your standard 6-minute bioincubation. And then you brought up jaw. So there's an excellent technique for doing a completely natural, non-surgical jawline lift that actually will also effectively treat the neck without directly injecting into it. You're going to use the 8 minutes of incubation, preferably with the hyaluronic acid tube, because you would think that using the HA tube would make it heavier and more difficult to push, but because the HA is hydrophilic, it actually seems to lubricate the Velora biofiller, and you get a little better handling characteristics from it. And you're going to take a 27 gauge, 1.5-inch needle, and you're going to insert it at the turning point of the mandible here. You're going to go up to the base of the mandible right before the joint space there behind the ear. And you're going to inject 1 to 1.5 cc's as you withdraw. And this is going to pull everything tight like this. Then you're going to go to the turn in the jaw line, and you're going to go in at a 90-degree angle, and you're going to do another 0.5 to 1 ml right here. And that's going to pull the double chin back, and it's going to pull the neck up. You can get, I don't want to say a facelift out of it, but you can get facelift light type results from doing that technique. And if any of you are providers or you have providers that want to learn those techniques, we do teach those at the hands-on clinical trainings. And then we also do have a nationwide team of certified clinical trainers that can come on site. If you would like to do a one-to-one with lots of hands-on training on these techniques, we do also have training videos that you get free access to as a Velora protocol customer, and some really great manuals, not only with written instructions, but step-by-step photographs, as well as Dr. McGrath is retired from active daily practice, and he works full-time as a peer-to-peer educator with us in between the live clinical training. So you do have a physician that you can literally call peer-to-peer and get some assistance with this pretty much any time, at least during
Well, and the other part too is
hours.
Gigi's a part of that team. That's one of the reasons why we wanted her on here, because Gigi does a lot of things for us too, where she's also setting up group trainings here in Dallas. She also has another practice in California. So there's an opportunity for, I think the key as we're looking at this is that we have a slew of talent that can be able to jump in here and play a very significant role in the way that you can change facial aesthetics forever. You know, I guess that's the best way to put it, because never in the past have we had this kind of capability at this economics in order to create facial change or restoration. And it is, and Lance, I brought back up the incubator at the same time because, and Gigi, I know you've played around with a couple of the techniques as well, because we joke about that sometimes because, you know, when you start to get really good at this incubator, you're literally going to have all, let me just throw this up here. You could literally be running all 4 of these different concentrations in the face based on what you need. You're going to learn a technique where you'll just start flipping them out right as they're done, throw them in the backside of the cooler, and then so it stops the thrombosis. And the next thing you know, that syringe is ready. And while you are doing the injection technique, the rest of it's being incubated. And you know, the one thing too that I want to go back and I wanted to throw the slide up of the incubation because I don't think people really understand this. The industry, when it went into PRP, and they started to get into what a platelet-rich fiber, and of course they used calcium chloride before, and then when that kind of got, you know, snafu'd by the FDA regulations, and it says now we have to be chemical-free, a lot of people went over to these dry block heaters, and they, fortunately, they create a structure that they feel looks similar, but what they don't recognize is what they've done to that structure. And one of the common threads that I oftentimes tell people, and it's something that often sticks, is that, you know, you fry eggs, you incubate chickens. One's creating you know where I'm going with that one.
I'm writing that one down.
Creates a dead substance that the immune system and macrophages have to come in and break down and get rid of, while the other one creates a natural living integration into tissue that creates a real restorative and regenerative. So when Lance, Dr. McGrath, and Stephanie were all playing a role in the, you know, development of this incubation, I oftentimes love it because Lance tells a quick story about, you know, discovering this technology while I think spending time with his aunt, and suddenly realized, oh my goodness, like we could turn
she was a crafter.
Yeah,
and
she
it
was a crafter,
ceramic
exactly.
heater. So she was using, Dr. Bob is actually responsible for this in the most consequential way, because we were doing an intra-articular shoulder PRP. He got called out of the room. We had a whole logic insight too that we would just work to the bone, and the exhaust fan would kick on this thing a lot. And the Mayo stand was close enough that we came back into the procedure room after I got called out to see another patient, and the PRP had become very, 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 very dense PRF. So dense we had to discard it, draw blood, and do a new sample. And then, being the inquisitive mind that I am, I was a little kid, I'd take apart toasters, see how it worked. I'm like, how the hell did that happen? Why'd that happen? So I'm microwaving PRP in the break room. I'm boiling PRP. I'm doing all these different things to see if we can recreate this process. Failing, 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 failing. Too dense, not dense enough. That one caught fire, so on and so forth. And I'm at my aunt's house, and she lives in Rochester, New York, and has a basement, right? And that was a crafting basement. So she was doing those beads where you melt them to make the little pictures. And I noticed that if you touched the heater, it didn't burn you, but it was still melting these little beads. And I'm like, can I see that? Can I play with that? Can I take this with me? So I brought it back to the clinic, and we're laying syringes on it and then rotating them like a little personal barbecue. And we get this consistency where it's flowable. And then I realized, going back to like automotive, if you're a gearhead, one of the first things you want is a ceramic header that takes the exhaust out, because it heats and cools quickly and it doesn't expand or contract, it doesn't crack. So it's a very controlled heat source. So then we spiralized it around these tube holders, and the white that you see is a nylon insulant. So we did a couple different things to make sure the heat's distributed evenly, and I guess you'd say gently, for lack of a better term. When you use a dry block heater, these things were designed for doing rapid bacterial cultures, rapid strep, et cetera, at the urgent care center. They're going to take your sample back where they swabbed you. They're going to put it in this thing. It's got a heat source at the bottom that comes to the top. And I was just consulting with a really large volume dermal and plastics practice in California that does about 500 to 600 cases of biofiller weekly with the Solenis. And they were going through their process and what they do and their great results. And then we hit this dry block heater aspect of it. I'm like, did you know that? And they're like, well, yeah, we know that, but it's really cheap. Your incubator is more expensive. And I go, yeah, but you're running 500-600 cases through there, cooking this thing. I did not know this. I just learned this. Their protocol is 110 degrees centigrade. We're 90, right? So that's the difference of being above and below where you're denaturing proteins. And the other reason that that's important when you're looking at the Velora protocol is because we're kind of discussing the standard Velora protocol with you tonight. There's also a pro or a plus version where you add exosomes and you use allograft tissue. And you can put exosomes inside the PRP and go through bioincubation. And because platelet-rich fibrin matrix, because that's really what we're making, it's got a dense, mature collagen bond that forms a basket weave type of structure if you look at it under microscopy. That traps inside of it the growth factors, the platelets, the exosomes. Exosomes are very small extracellular vesicles. They don't even behave with tissue planes. They can go through structures. They can go through bone and follow a cytokine trail. So localizing an exosome is really hard to do. But if you have these dense collagen bonds, these exosomes bounce off of it. They wind up getting localized for a period of time. So if you're spending a couple $100 on a vial of concentrated allograft biologics or birth tissues, you want them to work. This is a way to ensure they work where you want them to work. And in my opinion, this was actually one of the weaknesses with the vampire facelift. The vampire facelift allowed the PRP to diffuse through the skin and not be localized to the area where the patient had the loss of tissue and the tissue defects. So this allows us to really localize those growth factors and create targeted angiogenesis.
And I did see, Mark, on there, someone had asked the question of how you're integrating it with other things. And it's to Stephanie's point, that doesn't mean you throw out everything you have. And to Lance's point, I'm taking 25s and doing it preauricular on the gonial angle. It's turning out beautifully. But what I'll do, and Mark knows this, and I have some amazing pictures, is I've also mixed Sculptra with it. And yes, I can do those. And those pictures are unbelievable so I can set a base until I get them to the point. Or if it's somebody who you might have to use a cross-linked, if there's someone who, is, no jawline, and you might have to create that structure to begin with, and then, kind of switch it over once you get a basic structure for to go ahead and incorporate the Velora.
Mark made a good point earlier that we are all a bunch of nerds.
Yeah.
And so I encourage you, when you look, and he's right, and I say that
That's
absolutely
right.
lovingly and include myself in that, follow the science. If the science doesn't science, then it simply doesn't make sense. As Lance was talking about earlier, I don't want to call another, someone's baby ugly, but their methodology as far as creating a PRF isn't real PRF. To go
Correct.
from PRP to PRF, you have to recruit IL 4, 6, 11, and 13. If you do not have that recruitment, you have gel thickened PRP. We see this with spin down centrifuge systems all the time. All PRFs are not created the same because they simply are not scientifically. If you want to create a true PRF that is anti-inflammatory, this same PRF I can put in a joint space and get rid of every cortisone injection every steroid injection in the clinic. To have a true PRF, you have to have the proper interleukin recruitment to have an anti-inflammatory. If we do not have that, we simply have gel thickened PRP. And we see this with a lot of other systems. The second you take PRP, you overcook it, or PPP albumin, whatever version of that company, they all use different versions. You overcook that, you turn it into platelet lysate, and you resuspend it with PRP to make it flowable. And an anti-inflammatory that does not make on any level of science. So if we want to be very granular with the educational component of this, we have to be very real with what PRF is and why it works. Will those things create a dermal filler? Yeah, but they're also going to create an inflammatory response from the body, which is going to break it down faster. It's not going to stimulate collagen production. And so when we're talking to our patients in an educational forum of why this product is significantly better and why the Velora protocol is the master protocol in the evolution of natural aesthetics, these are the reasons why. This is why Velora was created. This is why what we're doing is so different in this space.
It's also why you don't have to overfill. You don't get the post-procedure swelling, pain, and discomfort that's typically associated with commercial fillers.
Yes, and it's also naturally balanced at the same time, which, you never have to worry about overfilling, underfilling. Like, it gives that perfect balance. And I mean, outside of a little bit induced swelling the day before, by the next day, you look phenomenal. It is.
Points. It is easy. And like you said, to your point, I can make it what I want it. So if I have a patient who I think needs jawline structure, who needs, the hollows in their temples done, but I need something a little bit smoother for under eyes, I can lay out the whole thing there and cook it a little bit longer if I need it, to have a little more structure, cook it a little less if I need it to be a little bit softer. And for me, that's rather than pulling out the whole line of, all the
let's be honest.
And, the whole.
Well, Gigi, you're right. It's very, very different injecting a 70-year-old 90-pound patient than a 40-year-old 200-pound patient.
Correct.
Those face structures in no way, shape, or form are similar. So to be able to have the only product that you can create custom fillers for every patient that walks into your clinic,
right,
that's a selling point.
Or
That's
even a custom
different.
filler to this point during the treatment. So
Correct.
that's the other key. I mean, without you having to open up
Yeah.
another syringe that has a higher cost structure to you, you can just stop the incubation stage and immediately, pause that thrombosis so it becomes the consistency you want. So that's great. I mean, in a single treatment, you literally could have 2 to 3 different filler types there.
Exactly.
Absolutely.
And you only have to say one name.
Yeah.
Go ahead. Just say it. Say it. It's Velora.
Velora.
By the
we
way,
go into Q&A now, just since I know we're about 12 minutes over.
Yeah.
So I just wanted to call on some of the people in the chat. Mark, if you want to pull up the Velora calculator, I think Tom had a great question about the cost comparison to the current fillers in the market. And I wanted to share
access to that right now, Jasmine. Sorry about that.
Okay, no worries. Do you want to just speak about that to answer his question?
Yeah, well, you know what? I mean, when you're looking at the ROI, I mean, as a matter of fact, Gigi, you might be a great person to talk about this at the same time, is just kind of take the traditional, 1 cc of filler, which, just kind of speak about that from a 1 cc perspective. And then,
And to Stephanie's point, we're looking at anywhere from the cost of us, $350 all the way up to $5, depending on it. That's our cost. So our ROI, even though our patients think, wow, you're making a ton of money. No, it's very marginal unless you're, charging a ungodly amount. With this, I have that flexibility to do, and how we'd put it to them as a multi-syringe or multi, kit discount, but we're still making a lot of money. But for the process, we can still charge, a fair amount. So on the business side of it, it is a little bit of a process. But for what they're getting, I don't discount, even though I'm, even though I'm using the kits and it's lower cost to me, for the expertise of it, for knowing when to pull it for what particular area, for knowing how, I charge the same amount because in my eyes, it's a better process for them, for their own, health and welfare, if you will.
In my clinics, I sell it as a premium. And I sell as a premium because more than anything, how much is your face worth in 10 years from now, in 5 years from now? How much value, if you're willing to financially invest in your face today, what does that look like in 5 or 10 years from now when you don't have to keep investing as much because you've done the things now? How many times in our lives have we said, God, I wish I could go back to when I was like 25 and be so much more serious about skincare? This is that opportunity.
Right.
This is what we're telling them.
Yeah. And Stephanie's right. And the prevention of what would happen if we continued down the pathway of using Bicross fillers, of using, PLLA and all the things. So that's something that you're going to want to prevent too. So we're giving them a fabulous result, and it's going to be even better for them in the long run because we're not going to create a long-term damage.
Well, not only that, but Velora is the only protocol that exists that's preventative aesthetics.
Correct.
Every other aesthetics in the market is reactive aesthetics. This is the only option if you're in your mid to late 20s and you want to start working on making sure you continue to, stimulate collagen production. You want to continue to microneedle to make sure that you're getting rid of the dead skin. It's like aerating a golf course. Right. It just helps continuously make it better. In moderation. But this is the only option for preventative aesthetics as well. We don't even have other options for that. Everything else we do, and we know based on the molecular weight of a filler, the second we inject that, it's causing damage because what happens when you inject a foreign object? The body's going to metabolize it, fight it, reject it. So if we don't put enough product in that face, by the time the body goes through that process, our patients aren't going to look filled out. They're not going to look happy.
Right.
And the patient retention won't be there anyways. But that extra bit of filler to maintain after that absorption process, that too causes sagging, dragging, fine lines, damage. So to crosswalk back into something more natural is an opportunity that we didn't have 10 years ago or 15 years ago. Right. So to have that available now, I think it's as simple as patient education.
Mm-hmm. Well, and again, I think too, Mark, absolutely, Stephanie. Well, because I think
that was another question that came up, patient education. I'm wondering if we can go to Gigi because we had a lot of questions come in about training. And so maybe we could have Gigi speak about that and what that looks like.
Sure. On the website, on the Rise Up Medical website, there's a link to my training facility. And so we have my assistant, maybe we'll get back to anybody who wants a possible training. And I am more than happy to give you all the pearls that I know. And the great thing about it is, I've been doing this for a very long time, but I'm not the end all be all because I'll be listening to Stephanie here going, "Oh, that's a good idea." And if she listens to me going, I'm going to try what she's doing because it's such a fabulous way to, open the toolbox and just keep adding to it. And so I am a huge, proponent, of really getting all minds together to doing this because sometimes I'll learn from a brand new patient to say, hey, would it make sense to do this? And it's just something I didn't think of. So I love teaching and having people there say, yeah. And it's a great place to start, as Stephanie's point. If you haven't used or if you're new at this, it is a lot easier to learn on this, I think, than it is with, it's a lot more forgiving. So I think it's a great place to start and learn and, just grow your practice for
We
sure.
just trained, I think we had 32 or 33 clinicians at an event we did just about a month and a half ago. And Dr. Bob, how many of those had never done a filler before? And after 2 days, we had them so confident because of the fact that this protocol is so forgiving and so easy to learn.
Correct.
It's a great way for new hires to get into it. One of the ways we break into a lot of new med spas and derms and plastics is actually they've hired a mid-level or they've hired an esthetician and they want to do microneedling of PRP, and then they want to have the NP or the PA be able to do dermal fillers, but they came from an urgent care setting and they have no idea how to do it. And this is a great way to do it, where if they make a mistake, it's not going to cost you a malpractice suit. If they make a mistake, it's not going to kill someone. It gives you a very flexible and safe, because it's an autologous therapy technology to use as you're gaining those skills, because there's no replacement for repetition. It's the more you do this, the better you get at it. And the more tips and tricks you pick up along the way, like what Dr. Goddard was talking about there. So this is a great way to let people put training wheels on and start to get good at filler. And then they can start doing some of the other things if they want to that maybe do have a bigger risk profile, like the Bella fills.
One on top of that one, be able to do more areas, because a lot of times people just get practice at a nasolabial fold or a marionette lines or maybe doing lips, where now all of a sudden you're having enough product where you're keeping your skill set up working the full face. But I don't want to discard also, I was just floating through some pictures just because we want to be sensitive to everybody's time, as some of you are on the East Coast. But this is something that with that kind of volume, you should be looking at adding additional services where you're going off body. You could never really go off body in a larger volume if you're going to do traditional filler. You would spend an ungodly amount. And yet there are practitioners that are trying that. I mean, with kind of like the butt lifts and things of that nature. If you look at what somebody is investing in order to get kind of a Brazilian butt in some fashion, it's ungodly expensive. But just doing simple things like hands. I mean, like taking this is one of Gigi's patients that we're treating, is just to show the difference in hands after just a single treatment. But then neck, I had another person wanted to do neck. I think, Lance, you guys were talking about that they're doing breast lifts and décolleté. And, we have people that are using it for the knees in order to kind of create the knee lift, or as you're doing it with the GLPs, where you're starting to do more abdominal restructure type work. I mean, there's a lot of categories that we can go there.
You got to keep in mind, this is a technology that's also FDA cleared for wound care. And billable, sans the HA component of it. PRF is a billable treatment for wound care. So that's part and parcel right there, that this regenerates skin, this regenerates vasculature. So you really can use it pretty much anywhere on a patient's body, on a patient's integumentary system.
I just did a training for a physician and her wound care team. And they, like you said, they hired a PA who, an RN who they want to do some of the aesthetic, but then we did so over the wound care and the hypertrophic scarring and a couple of things that she's really excited about it, and none of them had any experience with it whatsoever. And they were so excited and you were so impressed. It was like you had a magic wand. And, to them, they're like, I'm coming back.
Absolutely. Absolutely. Well, and you know what? And this kind of leads into, I want to just be able to go through some current promotions that we have on this, just because as many of you may be getting late in your space, we'll stay on here as long as people have questions. But for those of you that might have to leave off, I don't want you to miss some of these. We're also recording this so that we'll make sure that everybody gets it, so that you can use it with your staff. You can use it with whatever, because we can sit up here for a long period of time and just have fun with this. And honestly, we're scraping the surface of what we can really do here, because we haven't even got down into some of the inner workings of this and where it really has exceptional value. So when we look at this right now, we're going to be running a promotion and these are the PRP HA kits that are going to be used for Velora. The thing that I want to really express about this, and Lance and Stephanie and Gigi, you guys can back me up on this one, is if you didn't have the incubation technology, a lot of people are still using this for hydration. And since we're walking into the winter months where people get very dehydrated, or they just want that kind of what I call fresh angelic type of look, we want to let people know they could use these kits on their own just in that particular fashion without looking to create volume. It's going to be more about regeneration and hydration. And then when we get into the incubation technology, we're going to start looking about adding the volume side. So just so you know here, if for any of you that are making any type of investment in the PRP kits, for every 5 that you purchase, we are going to give you 1 extra, 1 free. So just to kind of give an example, if you did 10, then you're going to get 2 free. If you do 20, you're going to get 5 for, or 25, you're going to get 5 free. I love how our math got a little bit funky there at the end.
You got that.
Yeah. You know, it's one of those things that now we have to honor it.
Right.
There's a great question in the chat box. What makes Velora different from Sculptra and PRF? So first and foremost, Sculptra, while it's a great product, it is made of the same thing as sutures. While it's dissolvable, that does not equal natural. So when we have to define what we're talking about, natural, autologous directly from the body is what we're doing. PRF is great as long as you have proper interleukin recruitment. If you are spinning a tube and not incubating that in a proper way with a ceramic block heater, you do not have PRF. It's that simple. And so when we talk about that, the key is the proper interleukin recruitment to make it an anti-inflammatory. That's what we're working with specifically that is different than what most people are calling PRF.
Well, and I think too, one of the things when we talked about photoactivation before, one of the things that we missed on is not that it only creates the 8 times multiplier of proteins being created in that treatment, but the studies that you were all working off of when you created this also demonstrated that you turn those platelets into a regenerative machine for 28 days. So when you look at this and you're going back, and I know, Lance, you could kind of talk about this as well, but it is, when you're doing PRP, you have maybe a couple hour to 24-hour stage where that PRP is really working. When you start getting into platelet-rich fibrin, a lot of people looked at it because now you were able to kind of capture these platelets, keep them in place for about 3 to 7 days. When they start talking about platelet-rich fibrin matrix, it's a more tightly woven, more dense structure. They're seeing as much in studies as 14 to 21-day hold period. Now, here's the key. If you just turned your platelets into a regenerative machine, do you want them available for 2 hours, for 7 days, or for 14 to 21 days? So just know that when you're using the incubation technology and the photoactivator together, you're actually creating a very strong regenerative machine that's going to play a significant role in longevity. But the other part too, and we'll let you guys come back to this as well. I just want to let you throw one other promotional side out here as well, is going for any of you that really want to get integrated into the system, in doing Velora. If you invest in $6,000 worth of any kits, that could be 20 of the PRP HA kits, that could be any combination of our PRP biotin, our medical PRP kits, we're going to give you the incubation technology for free. That's normally a $5,000 technology that we're using. But we're really trying to look very closely with you all in terms of, helping to kind of ignite the fire in this field, of aesthetics to help us kind of push this out there in a grand fashion. And we think the best way to do it is to really give you the technology that you need to make this a success. We don't want you to be thinking about it. And then the last thing too that I want to really bring into this as well is that we have another program, and we've put a QR code up here where we're literally giving you the opportunity to own your area with Velora, where you could lock out other people in your zip code from ever having access to Velora so that you can establish you as the leading market user of Velora in your space. So that is something that has a little bit more complexity discussion to it. I don't want to take up tonight in order to go through all that. But if you'll use that QR code, you can actually schedule time with us and we can talk to you what that exclusivity arrangement looks like. But just know, we're going to be feeding you with all of the Velora kits to equal whatever that amount is. Plus, we're also going to give the incubation technology free. And you'll have the opportunity to lock out others in your territory to make this your own. So with that being said, I would love to be able to return to the Q&A for those that have to drop off. God bless you all. We really do appreciate you coming here in order to join us. But we also don't want to push people away because where do you get this kind of family gathering?
Exactly.
I love it. I learn something every time.
Right. I do love this question too, Mark. Missy wanted to know what the depth of the injection is. Depends. It's, if you want more volume, I'm going to go ahead on, say I want to create structure in a jawline. I will take a cannula. I will ride right along the periosteum. 100% I will do it. I'll go down right on bone. I can do, subdermal. It's the same thing. I kind of lift and tense my cannula to see where I'm at. Usually looks kind of opaque or right when you're right in that space. But the wonderful thing about it is if you happen to be in the wrong plane while you're learning, you're good. Nothing horrible is going to happen. We'll massage and fix it. And it's, stimulate some vessels.
That's right. You can throw your hyaluronidase away, right?
Can I ask you a question that we get a lot? We've had so much success using the Velora protocol below the eyes, basically from the temples down. We've had great success. I've had a lot of people, clinicians and patients and both asking, can I use this in the forehead? Can I use it for fine lines in the forehead? And technically, from our team on the panel here, we don't yet know how to do that. Is that something that you've done effectively clinically?
Yes, it is just like taking sculpture and doing on the same thing. I thin it out pretty good because we have, very little fat pad up there. So I'll kind of thin it out pretty good, and I'll take a cannula to it, aspirate just like we usually would, and you can ride right along that.
So when you look at the 3, 4, 6, 8 slide there, are you taking more of like a 4 or 5 minute incubation like what we do in the lips and also using that in the forehead?
Correct. I'll hit about a 4 just to make sure I'm not too thick because then I have a little grace there.
Are you free the weekend we're doing our next training to come be one of our clinical trainers?
Yes.
I'd really love to get that protocol down.
That question.
Yes.
Yeah.
It is. It's good. It's good. It really is.
Serious question though, because if you could teach 100%. People how to do that, that would be absolutely invaluable.
Yeah, it's fabulous. You can do it just like
Botox is falling out of favor too. That's the next thing.
Yeah,
oh wow. Yeah. Oh, absolutely. And it was amazing. Linnea I just saw she wrote on there that she's treated the brow bone and she's like, wow. And I know Linnea very well. She is another amazing injector, and I will tell you, she works with a plastic surgeon up here in Frisco, and it is she does some amazing work. So I have to coordinate you all with Linnea. I don't want to give you up on this slide, but you are of value. I just want to say that.
Oh, someone was asking Lenora how long the full process takes. Depends on how much I want to play and what patient I have in front of them and what they're willing to do. If it's somebody who's starting in the sandbox before they go to the playground, I'm going to be, I'm going to start them right where I think is, where they need it most. But I think probably, and again, the more you do it, the less time it takes. And that comes down to how fast are you at your blood draw, how fast, your incubation. If you really looked at the whole thing, for me, if I'm doing someone pretty quick, it'll take me about, I would say 35 to 45 minutes. If I'm doing, an hour, I can do a full face. That's temples, jawline, all the things.
But you're not in there the whole time. That's the key part, because that's doing the entire process. Like I've been in these cases with you, and it is, you're talking about photoacta, an 8-minute spin with a centrifuge all on its own. Incubation, or not incubation, but photoactivation, 10 minutes, all on your own.
2 minutes, yeah.
Incubation, a lot of times too, what we always try to tell people is that that's when you start doing patient prep, because that one there, like when it's ready, that's going to be a 4 to 8 minute, and I would really say 4 to 7 minute process. You want to be there to take that out and put it in the cooling mechanism so that it stabilizes, because that Velora, that biological filler is available for 2 hours afterwards. So
that's your time sensitive, is that
correct
portion of it. All the rest, super quick, and you either have an MA or somebody who can draw.
Well, that's what I was going to say. And if you have an MA, you can be running off doing other things while the MA is doing the prep work on all that, and then you can come in and do the injection techniques. So, to your point, I wanted to bring that up because we probably say 30 minutes of total prep time if you're doing all 3 steps. But at that point, really about 7 to 10 minutes of it, you're going to be in the room at that point as you're prepping the plasma gel, and then it's the injection time. So that's a great question. The other thing too, I had somebody up there actually made mention about the cost. So just to let you all know is that, the Velora kit costs $299 to be able to yield 10 to 13 cc's. So that is, and when we look at something like that, I would probably say most people are charging about $1,500 per procedure. It could go more. I think the nice part about this is when you're doing full face restoration, patients are already used to paying $1,500 for doing 2 cc's of just one localized area. So I think you have to play around with it in the way you see the value. The one thing too, and why they keep some of that cost structure down is because they are going to come back a couple more times more often until they get the restoration side. And I think Lance said it best is like, hey, if you came back twice a year with a traditional filler, you're going to probably be 4 times a year coming back with this. So, that's where you're going to kind of play around with your facial, your pricing structure. But I think at the end of the day, you also have this opportunity to go off face with great value, but then also $1,500 to do full face restoration. That's pretty damn good.
Yeah.
That's really good.
That's really
very
good.
Yeah.
And I will say this, if you guys have any other different pricing, bring that up there. We just kind of use that as a baseline because why actually start cheaping the market before anybody's even really gotten started in this? So at this point, you really are you're at an opportunity to set the price point yourself and then kind of work backwards. And we'd love your feedback because you're the ones that establish those price points. We kind of start with a gauge, but you're the ones that kind of help us end up where we need to be because we know the market eventually comes in and tries to, compete by lowering price rather than presenting value. At this point, you're in a position to present value.
There's a great question about joint application. Sorry,
yes.
Go ahead.
No, go ahead with that one.
And wound care too, and wound care.
Yeah,
so I don't want to forget.
I was going to throw that to Dr. Bob. Dr. Bob, since you are without a doubt the orthopedic expert, I will let you kind of touch base about how this can be used orthopedically and for wound care.
Well, for wound care, I mean, making PRF, I love it. I just put the clean the wound, hydrate the wound, and then I put the PRF right in the wound, and then I will go around the outside with like a 30 gauge needle and just do a little PRP on the outside, put a piece of Adaptec on it, some cling, say, see you next week. And it is amazing results with that. But as far as orthopedic applications, we really don't use the Velora, with the hyaluronic acid for orthopedic applications. The hyaluronic acid really doesn't work well
Correct.
because of the weight of the hyaluronic acid in a joint. But for regular PRP, okay, that you can start out with PRP, let's say in a knee, and what that does is basically goes in there, and I always use the analogy, kind of cleans out all the dead tissue, the osteophytes, the pieces of cartilage. Then you can finish up with a PRF, which is anti-inflammatory. So I do always a series of 3. I've always preached the law of 3s. So for 3 days with PRP, it's going to be a little bit inflammatory. You tell your patient starts to kick in 3 weeks. You're going to do a series of 3. And actually, in some of these cases, I do a series of 4. I end up with a PRF, for the longer acting of that.
And now we don't talk about this too much in aesthetics, but one of the things that PRF does have the ability to do is it's osteoblastic in nature. It can cause regeneration of chondrocytes, of hyaline cartilage, the hard cartilage that covers the bones. And in people that have, like grade 4 osteoarthritis, there's typically loss of that hard cartilage. This can help to restore it at the end of that protocol that Dr. McGrath was talking about. And aesthetically, we had a patient who had part of her jaw removed from cancer, a smoker, and we were actually able to rebuild a significant amount of that bone by using platelet-rich fibrin. And then we actually took it one step further by actually micronizing some of her bone, mixing it with the PRF, and doing that in the dental industry. That's what they refer to commonly as something called sticky bone. So while we don't usually do that in aesthetic application, that was an interesting bridge. There's actually one of our sales distributors was the woman who had this, and we did it at a training event and then a couple times thereafter. So you actually can rebuild not only soft tissue, but hard tissue with this same autologous product that you get from the patient. So, that little blood draw you do, it unlocks a variety of tools that you can use in various different applications thereafter.
I'd like to see Lance's study on that because there was one that Sculptor had that is not out, but it's in the mix, and it's the first thing I thought of was that's the first thing I'm going to do is ride this right along bone for somebody who needs a structure.
Absolutely. Absolutely.
Yes.
110% with osteo, to like you said, do
Osteoclast, absolutely.
We actually do a lot of
110%.
this in implant dentistry because it helps the implants graft into the bone.
Right.
That's your proof of concept, right? Is
Right.
using it in that application, but we can use it in other applications that might be beneficial to, whether it's cosmetically, whether it's orthopedically. And then the orthopedic application, particularly for regenerating the hyaline cartilage, is very well proven. There's many level 1 RCTs on that. So that's a very well proven application. If anybody on this call wants to dive deeper into orthopedics, I mean, please feel free to follow up with Dr. McGrath and I. We've owned and operated dozens of regenerative orthopedic clinics across multiple states. I don't think we have an actual accurate count of how many injections Dr. Bob has done orthopedically, but it's over 10,000. So there's a lot there.
Well, why not do 10,001, Dr.
Quite
Bob?
a bit, to be honest.
The next training he will.
That's right. That's right.
Next training he sure will. Look, it's like 11,000 in 2 days.
Oh,
yes.
I see a question. Oh, go ahead, Mark.
And I wanted to go back to Dr. McGrath here real quick in the fact on the wound care, because I know Rodney on here, who's a wound care specialist. One of the things too, PRP is starting to get popular within the wound care space. And we've seen, like with a lot of the literature too, even when they're doing traditional PRP, where they're just kind of like spreading it on per se, it can kind of get a little bit messy, or maybe they're doing a little bit of injection. It is, but with the platelet-rich fibrin matrix, a lot of times too, talk about the fact, is this something that you can just apply? And I say this because you get wounds of all sizes, right? You get them depth, you get them, you get them wide. And so a lot of times we get the question is, hey, can you just put a thin layer of this, platelet-rich fibrin matrix on there in order to do it? Or do you need to fill in the wound so it literally creates a flat surface and it acts like a subdermal, or structure that, before they put their wound dressings on?
Mark, it's going to regenerate anyway, and it's going to take a matter of time. Now, Medicare, I think they were paying for what, Lance, like 20 applications over
up to it is 20 applications. Yeah, absolutely.
The thing is that
we rarely get that far because it's so effective, but
it's so effective in doing this, and you'll start to see that granulation tissue at the bottom there of this. So you bring it back weekly, and however you want to put it, if you want to take take the peanut butter and really spread it on there, that's entirely up to you, but you really don't have to. But you do have to clean and hydrate that area, almost like we used to use the water pick, and now there's more elaborate things to do that. But the PRF, and then, like I said, you stimulate it with the PRP on the outside, and then any dressing that you want. I just use the Daptic and some cling.
There you go.
One of the coolest things we've seen added into the wound care protocol, I would say, is the shockwave. It's shocking, literally, no pun intended, how well partnering that in with that protocol works.
Yeah, that stimulates angiogenesis and really does help.
And stem cell recruitment. Pericytes are not used to being squeezed. So when a radial focused pressure wave passes through the tissue, it actually knocks the pericytes off of the capillaries. And then it's just like when you get startled and woken up, where am I? What am I supposed to do? And then they pick up that cytokine trail that we laid down from doing the PRP injection. And you can really do a great secondary recruitment of adult MSCs to those wound bed sites. And it's separately reimbursable 0512T and 0513T, separately reimbursable for wound care on top of doing the PRF and PRP injections that Dr. McGrath was just talking about there, which is GO465. So you can actually get you stack those two things. I mean, you're talking about over $1,000 reimbursement on a Medicare patient per visit on wound care, and that's without going out and buying those really expensive grafts that Congress has just slashed in the 2026 budget for CMS. Which, by the way, guys, for those of you that are aware of it, if you don't keep up on the politics and how they affect medicine, independent physicians are getting their first raise in the Medicare fee schedule in 41 years in 2026. Wow. The across-the-board reimbursement for physicians, outpatient, non-facility, the global fee schedule is going up nearly 8%. while the inpatient fee schedule for hospitals and facilities is going down 3.24%. So for the first time ever since managed care was implemented in the United States, we have a reduction for hospitals and facilities and an increase for independent practitioners, a long overdue correction. So these numbers we're sharing with you here today are 2025 rates. 2026, it's going to be the first financial relief for independent practitioners from CMS in as long as I've been alive.
Mhm.
Yeah.
So you're less than 41 years old is what you're telling us?
I'm about to be 41. Yes, sir.
Whatever.
I know.
Man, boy, wouldn't I like to say that one.
I
Well, when
know.
I was in my teenage years, that was when they changed all the rules.
I'm clearly not using enough of the Velora protocol.
Yeah.
I thought I was older than that, so I need to get back in.
Mark, there's one question here that Anne asked. Is it only for physicians or there's a position in a regenerative side of her practice, but she does not do aesthetics? It depends on the state you're in, whether, whether they allow RN and PPA to inject. If she's up for you getting trained and bringing it into aesthetic portion, if she's using it in regenerative, absolutely, you can take a training course and under her direction. Of course, anyone RN and up, should be allowed to inject.
At our last training, we trained some estheticians on microneedling and things that were inside their scope of practice.
Right.
We trained some RNs under direct supervision of MDs and DOs that are allowed to do many different things.
Right.
And that direct
In your
supervision
state in
looks different from
Texas,
state to
RNs
state.
have a very broad
Right.
scope.
Yes, exactly.
We do naturopaths. We train naturopathic physicians, and in certain
Colorado,
states
too.
like
Yeah,
Utah
Colorado and Texas.
and Utah, they have a very broad scope. So yes, and we can do like a little quick scope of practice check if you have any questions about that. We've bought a couple different documents from the American Healthcare Lawyers Association that defines scope of practice and corporate practice of medicine, and trained an AI agent on it. So I have a little robot healthcare attorney that we can bounce questions off of and at least give people some rough
Everyone needs one of those.
landmarks, and then go follow up with a local licensed healthcare attorney to confirm that the robot didn't lie, but at least point you in the right direction.
Yeah, exactly. Well, you know what? First of all, we have a tendency to get into these conversations and have a great time. And, we never stick with the hour. So I feel like the next time we do this, we're going to have to bring wine. Either that or espresso.
We do drinks with the doctor every so often with Dr. Bob. That's usually how we coax him out at night.
Yes, exactly. So the one thing that I just want to be able to say to everyone is thank you for joining us, because you really kind of make this a special night for all of us, where we kind of get to sit here with you in kind of a party-like environment and just enjoy sharing some of this information, because you're the ones that are ultimately going to change medicine. So it is, we'll certainly be around before. Let me go back to the code here again. If you want to set up any type of appointment, and it can be, we'll just make this easy for everyone. If you want to use that QR code, and when you use the QR code, there's a description side in the bottom of it that you could literally tell us what you're looking for. It may go to my calendar, but if you needed to talk to someone else, then we can kind of create that connection for you. So it is, and again, I want to thank our panelists that were on here at the same time, for sharing all that knowledge. I know that we could just keep going on for hours, but I love you all, and it is, and I hope that everyone here gets to love you as much as I do. So with that being said, I want to say thank you to all, and to all a great night.
Thanks, everyone.
Very
That's right.
Thank you.